Welcome. Thank you for joining today's webinar on addressing health equity, 3 GIS essentials with the National Association of Counties and ESRI. My name is Nastasia Welsh. I'm the Associate Program Director for Community Health and Justice here at NACo. I'm going to be moderating today's webinar. Just before we get started, just a reminder, this event is being recorded. It will be available on the NACo website after the event. We also have the slides up on the NACo website, so you can refer back to those. Please feel free to use the chat box to pose any questions you may have throughout the conversation, and we can direct those during the Q&A. We have a really important topic for today's discussion. We know GIS analysis does more than just map data. It tells really impactful stories. So we're really excited to have ESRI here today. A geographic information system, GIS, is a system that creates, manages, analyzes, and maps all kinds of data. GIS connects data to geography, your geography, so the county where you live. It helps us understand patterns and relationships and some of the geographic context by blending health data, so where things are, with descriptive information, what things are like there. So this session is going to introduce you to a technology your county probably already uses, but maybe not for your Healthy Counties activities. So our partner here at ESRI is going to discuss 3 essential elements of GIS for healthy counties. We talk about solving for humans in crisis, accessing healthcare and services, and enabling health equity, which I know we're all working towards right now. So with that, I'm going to turn it over to Richard Ledbetter from ESRI, and we are very excited to have him here. So Richard, I'm going to turn it over to you.
Great, and thank you for the introduction. Just to let you know, the slides are available as said. The links are active in that document. So anywhere you see a link in my presentation, you will be able to access those that content when you get the PDF of my presentation. Just to set some ground, it's always helpful, I found, especially with non-technical professionals, to give a little definition of what GIS is about. It's about data, it's about taking data, putting it into context. Geography is that context. We often describe counties as one attribute. Is it healthy? Is it not healthy? Do you have smokers? You name it, those kinds of elements, but there's more detail. You know, those problems, those issues that we need to address aren't ubiquitous across the county. They happen in place. They happen in very particular places. And to get that relationship, to get that context into your thinking, into your policies, is why I'm speaking at NACo. It has a number of elements. It's about data. It's about the geography, the map data that you know, but it's also about attribute data, the wheres, it's about the people, about the physical locations, about where you have flooding, where you have building, where you have building permits, and where you have maybe 311 calls, all sorts of data, any source of data. And there is a geographic element to all data a county uses. Then it's about analysis, being able to ask where and near. You can't ask those questions to a typical database. Putting it on the map provides you that insight to allow you to find those relationships that aren't explicit within the data itself. There's apps and analysis itself, the application of, let me go find this. Let me just have a small streamlined app so I don't have to be a technology professional. I can just use this app to find out the information I need, to run a dashboard, to do reports, to do analysis that I don't need to have input from. I will tell you, everybody on this call probably has experienced one of those apps in the past 2 years, and that's the Johns Hopkins COVID apps, where you go in, find out the US, the state, the county, your local COVID cases, both reported cases and deaths, and being able to compare that data and grab that data and look at it and analyze it. That's GIS. It's data that's been called out of nationally and locally into that one application, but you've touched GIS through that application. And then there's the maps. That's probably what you're most familiar with. The data after the analysis, presenting it in an information product. And that's one thing I want you to take away from this discussion today, that maps are information products. And information products should be maps in that they provide the context of where. And I know this is a problem in my county, but where in the county? As I said, it enables a lot of different kinds of data. It's both tabular data, maybe from your 311, maybe from your ERPs or your, all sorts of your public works data, maintenance data, school data. All of that is data that's available to put into geography, to put into your GIS. And it has a whole variety of, even a camera attached to the front of your transit bus, collecting data using machine intelligence to say, is that a signpost? Is that an illegally parked car? Are these people jaywalking? How many people are jaywalking? Is this something that I need to start planning for? And as an example, as a pop quiz about data, anybody have a feel for where this is located? And this works. That question works a little bit better when you're there in person. But this is Manhattan. This is the island. This is New York City. Any idea what this data represents? The biggest clue is it's not line data. It's point data. This is data that's been scraped off of social media through a big data exercise. The location of photographs. So looking at people and their social media and where they took the picture. You remember, your phone is a computer and it does have an X and a Y attached to those photos. So you're able to map that. This shows by color continent where those social media accounts existed. So yellow being Asia, red being Europe, and North America being, blue being North America except New York City region. So these are tourists that have taken pictures in New York. And what does it told you? It's interesting in itself. It's kind of artish. You could hang this on the wall, but it kind of tells you where people go. People on vacation from Asia tend to go around the Statue of Liberty and take tours on the waterways. People from Europe are kind of scattered, but they're down in the theater district. They're down in the financial district as well. And going off into Brooklyn, all the North America visitors, maybe they're visiting relatives or other people in the area. So from this, the New York region was able to start tuning their tourism. This is a far cry from health, as we're supposed to be talking about today, but this is how obtuse, how obscure data can be to an analysis that you may need to know. Another example of enabling data, this is cell phone data. This is these dots, the small little dots you see on the map, are homeless shelters. By using some technology to track cell phones, we know that people on public assistance have government issued phones. Surrounding that building, capturing the cell phones that are on in that building in the middle of the night, and then tracking where the cell phones went during the data, not the people, but the phones. Okay, all of this is anonymized data. We don't know anything about the people. We just want to see where they go during the day. And you can see that from the data that it's both in time series during the day, but also density. The more people that from that shelter that went to a location, the heavier the color. And from that, we can see that the people in that one shelter go long distances. Who knew? Then come back to that shelter that evening. Why are they going those dishes? Those are a lot of questions of why, where are they going? What's motivating them to go there? One thing that's come out of this is our services and where our services are located often dictate that we have to keep them. They have to keep moving. By locating our services 20 years ago, not moving them, not updating them, we're requiring this population to move around the city to get the best food sandwiches on a Wednesday, to go to their veterans support meeting, to get their social services, to go to a possible parole meeting, whatever social service they're engaged with. Now they have to move around. So understanding this data is an important aspect of addressing this problem. It all starts with identifying priorities. I like to call this aspirations. Priorities are often have a political or a bend to them that the next person along the line wants a different priority, but an aspiration is different. And these are aspirations that I've collected through smart communities, but aspirations all the same. And they fit in what we're talking about today. We want to do things. We want to make our actions, our policies actionable. And by putting them into these cubby holes of these aspirations, we're able to articulate. When I'm talking to a technical audience, I explain this slide a little bit differently. I say, you want to know what's in your elected official's head? These are the little cubby holes that you have to talk to. Don't come and say, I've got this technology, GIS, and it can do wonderful things. Talk about the opiate abuse, talk about homelessness and housing and how spatial allocations can help articulate that problem and set the right policy. Now, getting back to solving for humans in crisis, many of you might have thought that title kind of odd. Okay, but what we found, Esri has found over our 50 years, is that applications tend to focus. They have some familiarity. We've been involved in emergency management for a long time, and there's lots of lessons, there's lots of case studies, there's lots of examples within emergency management, responding to a flooding, hurricane, natural disaster, you name it. And these lessons are applicable, and they are applicable to health. If we start looking at our healthy communities, healthy counties through the eyes of a crisis, there are lessons that we can draw upon. There are transferable workflows that we can use, decision support tools that we can borrow from that environment and put it into how we address our health crisis that is going on. Ultimately, my hope is that this allows for some better decision making and some policy setting that actually has some ground truth in what's going on, what happened during the crisis, what's happening during the crisis, and how do we recover, how do we mitigate in the future. And if you have anything to do with emergency management and recovery, you know this symbol, but plan, recover, respond, mitigate, recover. And as the next crisis comes in, you start the cycle over again. So this is very much rote in the emergency fields. And I'm going to employ you to use this in your health and how you're approaching healthy counties. It's all about collecting data, being able to communicate your findings. This comes into mitigation and responding, deploying tactics, informing decision makers, what's going on in the field. How do you take that information and articulate it to the public? How do you engage the public with that information and get them to help, get them to be involved, get them to be aware of the problem so that we can address it in our existing plans, and then start over again to organize more data, keep it up to date, create new data if necessary, again, and follow along in that suit. The links on the right side are active. You can go and see some case studies, just a small collection of case studies that we have that might be meaningful to what you're doing in your work. Accessing healthcare and services. It's that geographic location. Back to that video I showed of the New York region. Where are my facilities? Where are the people who need those facilities? Are they commingled? Are they in the right place? Or did I create those facilities, those buildings where I have my social services 20 years ago when the population was different? Okay, GIS brings a scale, but it brings the ability to look at weather conditions and pandemic information and see the details that are going on within your community and to be able to address them in their location, not across the entire county where they're diluted. But to that, the maps enable public health officials to coordinate activities. We saw this with COVID and vaccine distributions and the logistics involved with stocking nationally. The same tools are available locally to help you guide the response to plan for capacity at each of your locations. All of those good things that GIS just does. These are examples. These are examples of different applications from different counties or decision support, being able to understand the budget and the personnel impacted, model the outcomes based on the current data, not past trends, being able to supply continuity of operation through dashboards, both public and internal. Civic engagement includes includes being able to do information products, both internally and externally, to allow people to be informed so that maybe they can reduce a lot of 911 and 311 calls, or allow them to do some of the reporting of where things are happening and need a response. To the dashboard and the operations being ahead of the curve of the data. I've heard it said by many elected officials, just as long as I know before the press knows, so that I can have the right response, so I can address the problem and have the right reaction, and as well as resource allocations. Again, some case studies that for you to digest. County-based, where these things have been brought to bear, and there's lessons to be learned in many of these links. And then equity. I don't think you can have a conversation today about anything a county does without having some type of equity lens applied to it. It involves whether it's poverty, age, living conditions, education, race, you name it. We need to start looking at our problems and our solutions to problems that we've always had, but through a more equitable lens. And it's location that's going to help you do that. It's finding a strategy that helps you effectively find where is the population that is most hindered by this problem. Where is the population of need? I like to phrase it as, using mapping and using GIS, we traditionally have been able to identify where we could address the problem. Through some modeling and some other use of technology and some foresight, we can actually start to take where we could address the problem and help identify where we should address the problem, or should start to address the problem. And again, there's much to be learned about repeatability through the analogy of a crisis management, but that's population health and management, being able to identify where my resources are versus the population that needs those resources. Community health assessments. You've seen these maps. This is the infographic on the bottom right corner is much like the Johnson & Johnson community, healthy communities matrices, where you can see actionable data about your health measures of the county on an ongoing basis, whether it's hourly, weekly, daily, yearly. That's how you set these information products up. But all of this can be the funnel that leads back to the policymaker, the operational owner of this data. Citizen engagement is, I repeat that again and again, but it's very critical in that, how do I engage? How do I inform? How do I let my population know this is happening? How do I let them participate in its progress? How do I let them know of any accomplishments that have happened to prove that, yeah, you are doing the right things. We're working all toward the right goals. And then there's just the identification of populations and performance of the activities that you're doing. These are all necessary activities that are going on in local government, and applying them to health is something that's wanting, something that isn't quite as mature as our public works, as our planning department, as all the other departments in our cadre. Again, some case studies, whether it's vaccine distribution, responding to the health crisis in itself. Will we even have the opportunity for what used to be, what was the same? Or will we come out of this quarantine period of having to do something different? And what can we learn? All of these examples that I've shown you today are built off of solutions. GIS is the platform that's going on in your county. I'm relatively sure there is active GIS in everybody who's logged on to this call today. Just about every county owns it somewhere in the county. As explained in the introduction, you have it. Are you applying it toward the healthy community aspects? So these are solutions that, after all of our experience, that we've learned that these are very repeatable. Many people do these kinds of workflows, and we've turned them into solutions. These are free solutions that you can build. They're meant to be installed, modified, not programmed, but modified and released, where you can have applications on your county's website that help you do, both internally and externally, different workflows. There's hundreds to choose from. I've highlighted some in particular to the healthy county agenda. I guess whether it's point in time applications where you're able to go out to the field, collect the data through mobile devices, simple smartphones, be able to collect the data and actually make more sense of the data in more real time. If I have one thing to stress upon you is NACo's advocacy needs to really press HUD in formalizing this. The system is still in a paper design mode, and how the data is collected and how the data is called by HUD is still a Tower of Babel. It's still not useful data to do any kind of trend analysis nationally. But you have control over your county. You have the ability to deputize volunteers on that day, collect the data, make sure the data is accurate and curated correctly. In particular, point of time. Okay, this is as I said, an application that has both a back office aspects where you're able to make sure that the operation is going smoothly as it's happening, but ingest that data that's being collected through mobile devices in almost real time, and then being able to field validate what you're seeing, how you're seeing it, and do the modeling of where the need is. As I said, social equity, equity in general is a lens that has to be applied to just about everything a county does now. It's grown. It's a piece fundamentally, it's a piece of geography that you need to understand just as importantly as where your voters are, where your citizens are that need assistance. That's a very defined place. As I said, it's not ubiquitous, but where are those populations? I challenge just about everybody to say, do you understand where your populations are? Because they move, it changes, they grow, they shrink, people move in, people move out, development occurs, and that mixes up these populations that maybe 10 years ago we understood. Okay, getting ahead of that, being able to apply that to your health and human services, but being able to address the new federal program, new federal money of older federal programs of lead in pipes. Okay, through that equity lens, after we analyze, okay, housing stock older than 1978 and pipes older than 1986, that tells us where we have the problem. The social equity lens is going to allow you to model the ability to look at that data and say where I should start my actions. I have a quick demo. This is a demo through slides. I thought it best to present it that way. But this walks through some solutions, how they're sewn together. And I hope to convey that it's rather straightforward and simple process to implement some of these solutions, and that it's quite doable to start applying it toward the healthy counties agenda. There are, as I said, there is a lead service line inventory solution, and it's meant to help you do both the field collection, the collection of historic data that you might have on record, with the ability to set priorities based off of regulations, both inform the public, but also lean on the public for data collection itself. So the application is such that it allows you to collect these data sources, both the historic administrative data that you might have about building type, age of building, age of the water line from your water utility, and be able to start identifying where things are that you need to start replacing. Is it a lead pipe? Is it lead solder? What are the other requirements that the new federal money requires you to understand? And model that to find out where you need to address the problem. Okay, being able to update this data internally and externally through many of the departments that all have a piece of this discussion. And then field applications, both for your own field employees, your public works employees, the water employees that will be out there in the field collecting data as it happens, but the ability to send and allow citizens to collect data from their water tap and using an application on their phone, be able to take the test and report the findings of do they have traceable amounts of lead in their own water, so that the county is the burden of visiting every home is reduced and you're able to collect that information a little more seamlessly. And for that, this gives you the ability to do the analysis and start creating work orders and tracking those work orders and being able to manage progress and the operationalization of these pieces of work and finding the new data, editing the data, managing the data itself, and being able to do the reporting, both, as I said, internally and externally. Okay, this is how the project progress is going, and these are the territories that I've done, and these are the number of things that I've addressed and how I've addressed them in what kind of time. As I said, as well as building the communication out to the citizens. This is an example of a hub, a citizen reporting hub where you're able to put data, maps, but context. Data about the data about the program, the ability links for those citizens can interact with and be part of the solution and part of the evaluation. And last, tying that equity lens onto the work that you're doing. Being able to evaluate the communities. Yes, we found out where we have the problem. This is where we could start to address the problem versus where we should. And this is an example of a model where we take a whole number of attributes, model them, measure them against and weight them. How important are these attributes to the overall model? Is it 10% of the problem? Is it 50% of the problem? And being able to put in these factors of endangerment. Okay, lead affects different people differently. And being able to understand by age, by demographics, by social settings, by income, we're able to identify areas that we, again, should start to address the problem with. And again, this data gets fed into the ability to measure progress over time. And once you've operationalized where you need to start your work, being able to report back on how it's progressing with a measure of social equity. And identifying the hotspots that you should start working with sooner than later. And with that, that's my presentation today. We have plenty of time for questions and answers if we have any. And Elena, if you could turn on, if you want to go through the questions. The slides will be available. Actually, they are available on the NACo site right now.
Richard, we did have a couple of questions come in. I'm not sure if you can see these. So one of the questions is, does Esri have a web service of USA spending data so agencies can see where services are being delivered on the ground, or can you recommend other related resources?
So USA spending data, such as what's coming out through the federal stimulus grants, or I'm not sure what USA spending data is.
Phil, do you want to elaborate in the chat, and then we'll come back to that question, please? And then John had a question about some technical questions about solutions. Can you direct me to the right people? Solutions is in quotes.
Sure. So I've been talking about the solutions, the equity solution, the lead service solution. These are all stand solutions. They are in the slides. The links are there. So download the PDF and you'll be able to go right to that page. There are hundreds of them covering hundreds of workflows that local government does. Again, these you can find out the background of the solution, what the solution does and how it sets up. But there's also data about how to download it, install it, and get it up and running. They're meant to be customized. They're supported applications. So as Esri upgrades our core technology, these will follow suit. They will work into the future. In other words, they're meant to be customized in that you don't have to program anything. You just make it look like your counties. You can change colors, put in logos, add your own, maybe supplement additional content that you want, that your particular county wants to make sure is there and present. But they're up and running the minute you download them and point them to the right data. But the links are right there in the website. We do not have an active map of that right now. It's one of the things that we're working on. It's moving. There is not a lot of update to the data so far. That's why we've waited for that activity. And the second part, the after ARPA, the infrastructure parts, that's all still waiting on the federal agencies to both grant and then track, and we're waiting to see how they're going to do that. But that said, they are promising connections so that we'll be able to do and create active maps on where that spending is. The ARPA funds and the CARE Act funds, where I'm not seeing much activity there from the federal side in keeping it up to date. Yes, it's been updated. It's showing it, but it's in very broad categories, whether they spent or not. We don't know what it was spent on. So that if you have a clue to how to do that, I'd love to talk to you. So call me afterward.
And Phil, I will put a link to NACo's COVID recovery page as well. If there's anything you're looking on in individual counties, we have a database where we're keeping track of what individual counties are doing. So I'll put that link in the chat as well, if that's helpful as we're continuing to build this up. Great.
There are some, I don't know if they're a .org or if they're a private sector company doing that in a little bit more detail. I don't know much about it other than they go around, much like NACo does with some of their data holdings, and go around and have to survey the individual jurisdictions and collect public works data and police data, expenditure data for all of those topic areas. But I haven't seen an indication that they're doing, that they have special call outs for CARES and ARPA.
Those were the two questions that we had that I saw on our list.
All right. I'll stress again, the links are active. There's well over a dozen county case studies for all of these various areas. So please investigate them. Nothing's better than learning from a peer on what they're doing and how they're doing it. And then if you do have a unique case study, let me know. Let us know. I'd love to get it into County Matters or put it into a blog on the NACo website. It's my job. It's what I do, is try to get those county stories out for you to consume and for everybody else to consume as well.
Great. Well, if there's no more questions, Richard, thank you so much for the presentation. Again, like you said, so The recording is going to be posted on NACo's website if you want to share this with your peers who weren't able to join us today, as well as the slides that have those active links that Richard was saying. Really appreciate everyone's time and questions today. And Richard, thank you again for being such a great partner to NACo and to our counties and our members here. So everyone stay safe, stay healthy, and have a good rest of your day. Thanks again.
All right. Thank you.